Hello everyone, this presentation is about climate change and dengue fever in India. A brief background, starting on the left-hand side of the screen, dengue fever is a viral infection that results from 4 different agents and is transmitted to humans, the hosts, through the bites of infected female mosquitoes, the vectors. Bites from infected mosquitoes are the only mode of transmission. If an uninfected mosquito feeds on an infected human, the virus replicates within that mosquito and is transmitted to a new human host, typically within 8 to 12 days when the temperature is between 25 to 28 degrees Celsius. This is known as an extrinsic incubation period. Dengue was once restricted to urban areas, but it is increasingly spreading to suburban and rural regions. On the right, you can see a graph that displays the incidence rate, and it's been increasing over the years. The expansion of dengue in India has been driven by complex interactions among host, vector, and agent that are all influenced by changes in climatic and environmental factors. There are many environmental and social hazards that have contributed to the increasing spread of dengue. It's important to note that the increase is due to multiple factors that reinforce each other, not one single factor. Some built environment and socioeconomic factors include man-created breeding sites close to residential areas. This includes tires, flower pots, household water buckets, and drains. Changes in natural environment due to industrialized agriculture, irrigation, and urbanization, which brings a lot of people together and increases the population density. Migration, travel, and trade have all contributed to the expansion of dengue in India and around the world. Tire exports particularly have been found to house the agent and host. As I mentioned before, if an infected human travels to a new area, the disease spreads when a non-infected mosquito feeds on this human, and then that mosquito will carry that virus for the entirety of its life and infect every human that it bites. The number of residents per room relates to overcrowding and population density. Poor quality housing includes lack of access to tap water, which results in people using more water storing containers, and inadequate disposal of solid waste or living near sewers or near ponds and lakes. Research has shown that lower household income, a socioeconomic factor, has been linked to dengue risk. And last but not least, the lack of personal protection equipment, such as window screens, nets, repellent, have been linked to increased dengue risk. Climate change is another environmental hazard that is responsible for impacting the spread of dengue. The relationship between vectors, agents, and climate is complex. This infographic briefly displays how temperature, rainfall, humidity, and extreme weather impact the spread of dengue. Higher temperatures increases the rate of vector development. It reduces the incubation period and therefore increases the rate of transmission. It also controls viral replication within the mosquito. I previously mentioned ideal temperature for replication is between 25 to 28 degrees Celsius, but at higher or lower temperatures, the replication can still occur. The incubation period will change, however. Rainfall influences the availability of habitats for larvae because the residual water creates some breeding habitats. Humidity increases the mosquitoes' chances of survival as they prefer more tropical, humid environments. Rainfall, temperature, and humidity together indirectly influence land cover and land use, which can promote the growth of vectors. Extreme weather events typically lead to changes in how humans use the environment. So in a drought, people may store water in containers more frequently, and if there's flooding, it will increase humans' exposure to breeding sites. So how certain are we of a causation relationship between climate change and dengue? Climate change is frequently cited as the cause of dengue. However, these studies are predictive modeling studies. They're flawed because they only focus on a few variables such as temperature, humidity, and rainfall. Finding research on temporality was quite difficult since epidemics of dengue have been occurring for over 300 years. Without adequate data from the past, it was hard to determine if dengue emerged before or after exposure to any key indices of climate change. However, there are claims that dengue was already present but began to spread post-World War II with economic, population, and urban growth. There is consistency in observational research findings across the world. There's strength in association. There are strong measures of association such as incidence rate, odds ratios, and relative risk. And empirical relationships have been identified between climate conditions and dengue, but causal relationships have not been firmly established. As I've explained in previous slides, there are multiple factors that reinforce each other between the environment, socioeconomic, and demographic factors, and they are all driving the spread of dengue in a very interconnected way.
Dengue is the most rapidly spreading mosquito-borne viral illness in the world. Estimates of disease burden vary significantly according to the agency from which the data is retrieved, and is complicated by the fact that there is significant underreporting of this illness. Global infections reported to the WHO in 2019 showed that there were 4.2 million cases and 4,032 deaths. Modeling data done at the same time suggests that the cases were actually closer to the magnitude of 390 million. In India, the infections reported to the Indian Health Service in 2019 was closer to 157,000, and associated deaths were closer to 166. However, in India too, modeling data suggests that actual cases were closer on the magnitude of 8 to 12 million. Demographic analysis of cases in India suggests that there is an equal age distribution between ages 5 to 45 and no significant difference between children or adults. Similarly, there was no significant difference in the infections between males and females. When we looked, however, at geography, we did notice that there was an increased amount of infections in urban areas, thought primarily due to unplanned urbanization and need for keeping stagnant water due to lack of running water in these areas. The etiologic agent associated with dengue fever is a DNA single-stranded virus. Importantly, there are 4 different strains of this virus, which means that a person can get infected with dengue 4 different times in their lifetime. The vector that carries this virus to humans is the mosquito, and there are 2 types of mosquitoes which carry the virus. The first is the Aegypti, which has a predilection to urban environments, and the second one is the Albopictus, which has much more adaptive capability and is associated with spread beyond the tropical areas. As mentioned earlier, estimates of the burden of disease of dengue fever is often difficult to ascertain. This is due in one part because of the wide range of clinical syndromes that are associated with the disease. Of the 390 million cases that are estimated to have occurred in 2019, only 96 million were clinically apparent. The majority of those were mild to moderate disease, in which a person would usually have fever, plus myalgias, nausea, eye pain, and/or rash. These symptoms would usually last anywhere from 2 to 7 days, with recovery occurring in 1 week, and could resemble majority of any other kind of viral illnesses. However, 1 in 20 of those cases go on to develop severe disease, which consists of abdominal pain, vomiting, bleeding from the nose, gums, and stool, and can eventually lead to hemorrhagic shock or death. Confirmatory serologic testing when dengue fever is suspected consists of either molecular testing, antigen, antibody, or NAT testing on tissue samples. Currently, there is no targeted antiviral treatment against dengue. Treatment is primarily supportive, and any mitigation of health impacts primarily occurs through vector control or prevention of infection by other measures. There is currently 1 vaccine that's been approved for use in people who have had a prior confirmed infection with dengue. Vaccination of unconfirmed cases is not approved because this increases the risk of severe dengue. Barriers to both supportive treatment and diagnosis of people with dengue center mainly around the cost and also the lack of healthcare infrastructure in many of the areas where dengue is most prevalent.
Environmental justice. In India, elevated dengue risk has been found to be associated with suitable local temperatures and high rainfall. The climate of India is strongly influenced by the southwest monsoon, which brings heavy rainfall from the month of June all the way to September. Enhanced rainfall has been associated with an increase of Aedes breathing, which is another term used for mosquito breathing. The highest level of precipitation occurs over the western coast of India, highlighted in purple, and the far eastern states, highlighted in blue. The weather conditions increases mosquito spatial range, thereby leading to an increased risk of dengue infection. However, there are people who live in dry conditions who have little access to water and have to store water near their household. How do they store water near their household, you might ask? Well, a lot of people go ahead and collect water in buckets and bring it all the way to their home. This attracts the mosquitoes, which can also increase the risk of dengue infection. Favorite breathing places. Some examples of favorite breathing places are desert coolers, drums, jars, pots, buckets, flower vases, and many more. I have attached a picture on the right to give you a better visual of breathing places. Social equity issues. When it comes to social equity issues, I like to touch on the fact that dengue disease is poorly quantified in India. Also, when a person gets a fever, it is less likely to be diagnosed and reported. There is also no population-based studies that have been done which estimate incidence of dengue in India. On the other hand, very few studies are available about dengue seroprevalence in India. These studies were either done on a conveniently selected sample or were limited to a few cities. When trying to find the disproportion of impact within individuals with dengue in India, I found the study named Burden of Dengue Infection in India, 2017, a cross-sectional population-based serosurvey. This study wanted to know how many people have had this disease during this time period. So they created the cross-sectional community-based survey. They went ahead and added 5 geographical regions of India, such as the North, East, West, South, and the Northeast, and they covered 3 age groups such as 5 to 8 years, 9 to 17 years, and 18 to 45 years. They also adopted a multi-stage sampling design, and they collected blood specimen of 3 millimeters. 12,300 individuals were used for estimation of dengue seroprevalence, and out of the 12,300 individuals enrolled, 33 were in the age group 5 to 8 years, 34.7 were in the age group of 9 to 17 years, 32.3 were in the age group of 18 to 45 years, and 52.75 were women, as 47.3 were male. 50.7 were residents of rural areas, and 8.2 had no formal education. 43.6 had below poverty line card, and 74.5 reported that their households received pipe water from drinking purposes. In the study, the seroprevalence was highest in the southern region with a 76.9%, followed by the western region with a 62.3%, and the northern region with a 60.3%. The seroprevalence was lowest in the northeastern region with a 5%. If you take a look at the table on the right, you will see all this information on the All Regions tab. The overall seroprevalence was higher in the urban areas with a 70.9% than in the rural areas with a 42.3%. If you take a look at the men and women differences, the men scored a 50.9% and the women scored 47.5%, which means that the seroprevalence was not very different among men and women. In the study, we also find out that the contributing factors to the major drivers of dengue epidemic have been rapid urbanization, globalization, climate change, ineffective mosquito control, and population growth.
Hi, my name is Alicia Lehrhoff, and I will be covering the solutions and target audience message portion of this PowerPoint presentation on climate change and dengue fever in India. India has worked incredibly hard to expand their testing facilities and diagnostic laboratories. As you can see on this map to the right, there is a large cluster of testing facilities at the southern border in India. The southern hemisphere of India is exposed to dengue fever all year round from their mosquito population due to increased temperatures, where the northern hemisphere is only exposed from April to November during their warmer months of the year. Once an individual has a confirmed case of dengue fever, they are eligible for the dengue fever vaccine. I suggested that a dengue fever case database be created in each individual state of India to track who has confirmed case and is now eligible for the vaccine once they have recovered. In addition to the vaccine, community awareness of dengue fever must be a priority between the Union Ministry of Health and Family Welfare, which is India's public healthcare system, and working together with each state of India on community education. Each state can have multiple dialects between citizens, which can make education on dengue fever difficult to understand and pass information along. A solution for this would be electronic devices such as smartphones or computers, which can translate informational knowledge on dengue fever to a dialect of preference based on the individual's location and serve as a solution for the community education on dengue fever in India. Healthcare costs for dengue fever cases can be quite expensive as there is no treatment option, only palliative care such as pain medications to combat a fever and lots of fluids to stay hydrated. Providing free mosquito nets to a citizen is significantly less expensive than any type of treatment option for dengue fever. Mosquito nets can be a vital resource for those living in poverty without enclosed shelters. Mosquito nets can be worn on top of any clothing for those working outside or those made into a canopy to get a good night's sleep as seen in the image on the right. Mosquito nets can also be reusable until there is a big hole enough for a mosquito to fly into. Mosquito net canopies are a great option for those living on the street or in the slums and do not have any shelter at all. Those without a fresh water source are more likely to keep standing water, which is also a breeding ground for mosquitoes. If the Union Ministry of Health and Family Welfare worked with the individual states of India to provide a clean water source to those in need, the mosquito population would decrease due to their breeding grounds being removed. In addition, an insect control plan could be put into place to sterilize mosquitoes over time, which would decrease their population as well. India is a member of the Paris Climate Act, which is a worldwide agreement to combat climate change. Each country set an individual goal for themselves to decrease emissions with hopes of lowering the average temperature increase that we have been seeing annually. India is working towards its current goal of decreasing emissions by 33 to 35% by the year of 2030. Lower temperatures will decrease the mosquito population since they thrive in a warmer climate atmosphere. With less mosquitoes present, hopefully India will start to see a decrease in their dengue fever cases. One of India's largest challenges in public health education is their language barrier as well as their literacy rate. Between many diverse dialects and those that are not able to read, communicating any public health information becomes challenging. I would propose utilizing smartphones and social media as a communication platform as well as a translator app on a smartphone to be able to translate information between the different dialects in India. In addition, I would create posters with images with simple wording to help those who cannot read understand preventative measures for dengue fever. A great example of this is this poster on the right created by Hyatt Health Services. We are sending this message to anyone that is exposed to mosquitoes or the outdoor air in regards to dengue fever in India. In the northern hemisphere of India, dengue fever is a concern from April to November, and in the southern hemisphere of India, dengue fever is a concern year-round due to their hot climate. The most susceptible population is really anyone that spends time outdoors. So that's workers that work outside, individuals that unfortunately live on the streets or in the slums, individuals that don't have an enclosed shelter, and anyone that cooks or spends time bathing outside, as well as children who may spend time playing or going to school in an outdoor environment. We are also trying to spread this information on a larger scale to the Union Ministry of Health and Family Welfare and state public health officials in India so they can do their part to help Indian citizens eradicate dengue fever. Here is a list of references that we have compiled working on our presentation of climate change and dengue fever in India. Thank you for taking the time to watch our presentation and learn about climate change and dengue fever in India. Here is a list of our references for our PowerPoint presentation. Thank you for taking the time to learn about climate change and dengue fever in India.